There is a lot of discussion going around these days about hormone replacement therapy, about peptides, and I get a lot of questions about should I be using these things? Is this something that I think I need to use? Is this something that's going to benefit me? So, today we're going to talk a little bit about my personal journey with HRT, and we are going to talk about some of those topics that you guys are interested in. So I have with me today Mr. Elliott Rule. And Elliott is one of the individuals who assists me with the clinic that I'm using. So I currently use Whitmer Rejuvenation Clinic to get my HRT. And so we're just going to have like a really laid back conversation today about what we should be thinking about when we're potentially looking into hormone use, peptide use. And I also want to talk a little bit about what my experience has been. And Elliott's going to be here today to help guide that conversation. So, Elliott, welcome. Do you want to just do a quick intro for us so that people can know who you are?
Of course. Yeah, thanks for having me, Susan. My name is Elliott Rule. I work with Whitmer Rejuvenation Clinic. If you've ever been with us or called us, you've probably spoken to me at some point. But I work primarily on the peptide side with patients there. I have my peptide therapy certification through SSRP, and we've been able to do a lot more with that in the past few years than we had prior. So exciting stuff.
Yeah, peptides are a big topic, especially when it comes to the rehab space, but also I feel like people are way more in tune nowadays to wellness, to staying healthy, to, wanting to stay mobile and young longer. And I think peptides play a big role in that, especially in cognitive processes. So maybe let's dive into that first a little bit. Let's kind of talk about how peptide therapy, maybe give us some examples of how peptide therapy can be beneficial for individuals, especially maybe individuals in the tactical space.
Yeah, of course. So there's a lot of roads we could go down there. Specifically inside of the tactical space, there's going to be a lot of people that have, like we've spoken about in the past, serious HPA axis dysfunction. And that's going to lead to things like chronically elevated cortisol or a lack of a cortisol response throughout the day. So we're going to be seeing things like being on edge, unable to sleep when you're supposed to be sleeping, or be awake when you're supposed to be awake, accompanied with things like accumulation of visceral fat and messed up hormone panels. But I'd say on that side of things, the primary thing we're going to be looking at is going to be the growth hormone peptides. So we have a few options on that side. The most common, the one that gets the most talk, is going to be the combination of CJC1295 and ipamorelin. The reason why that one is so advantageous is because it combines what we call a growth hormone releasing peptide and then a growth hormone releasing hormone. So the growth hormone releasing peptide will cause the pituitary to release more growth hormone, and the growth hormone releasing peptide compounds that, amplifies that, and you get a much better pulse from that. Yeah, and on the cognitive side, that's a tough one because we have a ton of data on some of these peptides, but the regulation on them has kept it from being common inside the US. So the main three that come to mind that we'll be looking at are going to be Selenk, Cmax, and NAD+. NAD+ is not a peptide. It's a little bit of an outlier in that conversation. It's actually a coenzyme that regulates metabolic function. In mammals, it's present in every single cell that we have in our bodies. And it's been, everything from DNA strand repair to, fixing dysfunction of the mitochondria. It's a very interesting one.
Yeah, let's back up and go back to some of these growth hormone secretagogues that you kind of mentioned at the beginning, and
Yeah,
let's walk through those in a little bit more detail. So
let's
when
do
I'm
it.
working with my athletes, one of the things that we'll do sort of in our community coaching is talk about, how those peptides are actually interacting to stimulate that growth hormone response. And then go into like some of the specific benefits that that growth hormone can have for somebody. Can we just put a little bit more detail around that?
Yes. So growth hormone, it's going to depend a lot on the background and the age group that we're talking about. If we're talking about somebody that's getting into their 30s, 40s, 50s, those growth hormone levels are going to be dramatically different than they were when these guys were starting out in their 20s. So growth hormone is going to regulate everything from cognitive function to, regrowth of bone tissue, uh, control of where fat deposits, as well as things like circadian rhythm. So when we see growth hormone decline in people, we're going to see an increase in visceral fat accumulation. We're going to see a decrease in cognitive function. And we're also going to see a lot more injuries present in those populations. There's a lot of factors that go into that. Everything from, if you're not sleeping properly, if you're not eating properly, you're not going to be able to inject these get out of growth hormone and fix every problem that you have. But if we're taking care of our bodies, nutrition is dialed in, and we're adding in something to bring those growth hormone levels back to where they should be, we would expect the first thing that patients are going to notice on these things is going to be that they're sleeping better. I can tell you from my own experience, I had a hard time going to sleep and staying asleep. It's not a silver bullet, but my sleep got dramatically better when taking these things. And also I was a lot more regular. I was getting tired when I was supposed to be tired. I was awake during the day. So the reason that I initially picked it up is because I have a pretty bad hip. My labrum is pretty well torn up, and I was still competing in a collegiate track and field at the time. They were wanting to go in and do surgery, and I was not really game for that, as it would have been career ending at the time. And I don't expect that hip to ever be the same once it's been opened up. And so I tried the TB500, the BP157 route when it was available. Unfortunately, that did not do it to me. I was hoping that the increased growth hormone and the added muscle that I could possibly put on in that would help keep that socket a little bit healthier than it would have been otherwise. So I have used those for probably a cumulative year at this point, on and off. But sleep is going to be the biggest impact I see there. That and sustained energy levels throughout the day because of that increased growth hormone is to be expected as well.
Yeah, and when you kind of mentioned the BPC and you were using that to rehab, talk a little bit more about those as well. What are we seeing, as far as like when is an appropriate time to use those? I do get a lot of questions on how long somebody should be using them for, and I definitely have recommendations that I give, but I'd love to hear from you kind of what that looks like.
Yeah, so those are both very hot topics right now. We're getting a ton of questions about those at the clinic. I see everybody talking about them. If you hear me refer to something called PDA, I'm saying that in place of BPC 157. Unfortunately, about 2 years ago, BPC 157 got a Category 2 flag from the FDA, meaning it's a bulk drug category, and it can't be compounded by any pharmacies. So what we have available now is called PDA. It's the same 15 amino acid chain as BPC was, with an added arginine salt to make it a compliant alternative, is what we would call it. So with those two, they're not going to be fit for every injury, and they're not going to work for every single person. There's not a downside to using them indefinitely that we know of yet. But at the same time, if you're just going for better recovery in and out of the gym, feeling better on a daily basis, it's probably not the best option. We'd probably want to look into one of the growth hormone peptides that we have available. One of the main questions that we get all the time is the differences in between BPC 157 or PDA and TB500. So with BPC 157, the primary driver there is going to be connective tissue or collagen regrowth. So it accelerates collagen synthesis and promotes angiogenesis, or the increase in blood in new blood vessels. On the TB500 side, that is going to be a better one for soft tissue injuries, whereas the BPC kind of rebuilds the scaffolding around the injury. The TB500 is going to be the main driver in healing the tissue itself. And on the TB500 side of things, we also have seen some pretty good data that there's some cardiac effects from that as well that can be pretty beneficial. The main one is going to be left ventricular function has been markedly improved by use of that, especially in people that have athlete's heart, which I imagine is pretty common within the population of people that you work with.
Yeah, for sure. So let me ask you this. I'm going to put you on the spot here. I'm going to give you
Okay.
like a scenario, and I would love for you to kind of walk us through how that process would look like once we are, in the Whitmer system, right?
Yeah.
So really common like profile I'll give you is I'll be working with an individual, late 30s, maybe early 40s, has been, uh, doing their job on the front lines, whether that be in law enforcement or in the fire service or whatnot, for, at least 10 years. And they've just been kind of burning it down, right?
Hmm.
High stress job, probably shift work involved, probably some stress at home as well too.
Sure.
Um, whether that be related to financial or marital or whatnot. Somebody who probably trains pretty regularly, maybe even is susceptible to overtraining, has a generally healthy diet, but they still feel like they're struggling to maybe recover. They feel like their energy levels are not great. And so, they're coming into the system to try and get help with that. What does that look like from intake to output?
So the first thing that we're always going to want to do with most patients is run a blood work panel. Um, we can take, what they're saying about training, we can take what they're saying about diet, but we need real data on what is actually going on inside their body. Assuming that all of that comes back clean or relatively within range, that's when we're going to start looking at things like peptides as additives to what they're already doing. So that at that point, though, we need to stress that nutrition, sleep, and training need to be dialed in before adding something in like a peptide. These should be looked at as extensions of the supplement cabinet rather than, silver bullets for fixing injuries or chronic fatigue, whatever we're looking at. So going off of that, assuming that hormones are dialed in, everything looks good.
I have a lot of people who are like, they want to make those changes. And we can also start like segueing into looking at hormone replacement therapy too, if you want.
Hmm.
So, a lot of individuals look into using peptides and possibly even hormone replacement therapy, even as they're making some of those changes to their nutrition, their lifestyle, their training. And so, they get the blood work done, uh, and they're going to sit down with a provider to go over that blood work, who I know isn't you, but just thinking
Right.
ahead, what are some things somebody needs to be thinking about if they want to do, that concurrent therapy along with making those lifestyle changes?
Yeah, sure. So the nice thing about peptides and HRT is they very rarely interact. So we can really work on one thing at the same time as we work on the other. That said, we get a lot of people that, develop problems that have maybe been put off for a couple of years. They haven't been feeling well. Their energy levels have been bad. Their libido is non-existent, and they haven't kept up with themselves very well. To come in and then
Go
to
ahead.
try to fix everything all at once is usually the main priority, whereas this is probably going to be, a several month process at minimum to be able to get some of these things fixed. So we often get guys that, get super motivated to come in and they want to start TRT, they want to start all these different peptides and do all these things at the same time. Whereas we're looking at it, let's get lifestyle dialed in. Are you eating, enough? Are you training, at least 3 to 4 times a week? Are you sleeping at night? Is your testosterone levels within range? Because with guys, that is, the pretty much the only thing that we can change to go ahead and get things feeling better. But looking at peptides to add in on top of that, like I said, there's not any interaction between most forms of HRT and peptides. So if somebody has, some sort of cognitive dysfunction, brain fog, we can go ahead and add in something like NAD on top of a TRT protocol to hopefully fix those things at the same time. The downside of that is if there is a negative response to one of those things, it's tough to trace which one that could be back to it, which is why we really encourage patients to start one peptide at a time or one treatment at a time so that we can figure out what's working best and what's not working and move from there.
Yeah, I think you kind of hit the nail on the head, right? Like it's not a quick fix. There has to
Hmm.
be some adjustment to lifestyle. And I see that pretty frequently where I'll have individuals come in, they're potentially carrying some additional extra body fat, or their sleep is just garbage.
Hmm.
And I think sometimes they get into the situation where they hope that TRT or HRT or peptide is going to kind of fix all of those problems. And while I think it can help, I think, right, you're kind of uh, taking one step forward and maybe two or three steps back if you're not adjusting that lifestyle in addition
Right.
to whatever therapeutics you might be using. And so I see that
Yeah.
a lot. Or clients will come to me and they want to start it TRT. They have lower testosterone levels, but again, their sleep is trash. Their visceral fat levels are really high. And so, doing
Hmm.
everything we can from the nutrition side, optimizing body composition, optimizing sleep before we jump into any of those therapies, especially, sleep being, I would say, one of the number one testosterone killers
Yep.
within the tactical community for sure.
Yeah, I would totally agree. There's what we can do from our end of things is bring things back within the range. Um, we wish that it was possible to go through with everybody and tackle these lifestyle factors.
Hmm.
Look at everything from caffeine consumption to how much are you eating, what do your macros look like, how much are you sleeping, are you socializing. Unfortunately, from our side of things, that's just not possible. So we focus very heavily on the hormone side of things.
Hmm.
We also understand that if somebody, has been, for lack of a better term, not taking care of themselves for a number of years, finally gets the motivation to step in and start taking care of things, if their testosterone levels are in the tank, that's going to be a serious uphill battle to get back to the point that they want to be at. So it's
Hmm.
not necessarily that we want you to fix everything before you get to us, but start making the positive changes so that when we get hands on, we're progressing as fast as we possibly can to get things to back where they should be.
Yeah, for sure. And so this is, like if you're working with someone like myself and then doing the therapy, really that's going to
Hmm.
get you, I think, more result than if you're just doing one or the other, especially if you're a good candidate
Absolutely.
for peptide or hormone replacement therapy.
Absolutely.
Yeah, so let me ask you this, just curious, as someone who uses hormone replacement therapy myself, I'm just curious if kind of like along even like female athletes or female individuals, right?
Hmm.
As we start getting into a certain age where our hormone levels change, hormone replacement therapy can be really beneficial. But I feel like there's just not a lot of discussion around it, right? And I'm going to kind of
Right.
like vent here for a second. I feel like,
Go for it.
you know, when we look at like the male population, we see, okay, like in your 40s, like that testosterone is going to start to drop. And that stigma of using hormone replacement therapy, as you get into those 40s and 50s, right? Like that's really,
Mhm.
I don't feel like there's a whole lot of stigma there anymore. I think that's changed really a lot in the last 5 years, but I think there's still sort of within the female population this idea that, hey, like it's menopause, like it's perimenopause,
Yep.
like it's just a natural part. You're just going to have to deal with it, right?
Yep.
But what's crazy to me is a lot of the symptoms that I was experiencing prior to starting hormone replacement therapy were very similar to a lot of the symptoms that males talk about when they're going through that change of life. Like my libido was completely gone, the
Hmm.
insomnia was crazy. Like like rage like I've never felt
Yep.
in my
Yep.
entire life. Like just
Yep.
no drive, no motivation. And like I gained like 10 pounds in the course of like 12 months, right? Which
Yep.
like that's never been a thing for me, like we eat healthy, we exercise. Normally we're getting tons of great sleep. We have a really great lifestyle. And so to go through that change for me was really jarring. So kind of like talk to me a little bit about what you're seeing as maybe more females are coming in, or what that, what are your thoughts around that?
That is a great question. And this is going to end up putting me down a rabbit hole. So you might have to bring me
Let's do
back at
it.
some point.
Let's do it.
So we'll start out with the guys side. For us, thankfully, things are pretty straightforward. there's, a certain number of things that can go wrong, and they're pretty traceable to what it is and what we should expect. Not only that, but it's the stigma behind TRT, like you've said, has pretty much gone away within the last 5 years. It's been something that's, become expected of people. And then especially among people my age, it's something we look at as this is something that is going to occur with us at some point, not as, this might happen at some point down the road. On the women's side, there's just not a lot of talk about using HRT, which is really unfortunate because, it is a more complex system, but the issues within that can be a lot worse than what the guys are going to experience. So with us, it's, muscle loss, brain fog, lack of libido, increased body fat. On the women's side, if estrogen levels are in the tank, there are legitimate issues that can happen with that. Everything from bone loss, dysfunction of cardiac rhythm. We've seen heart palpitations. Brain fog is another serious one. Loss of bone mass, loss of muscle tissue, increased body fat, severe mood changes. And the women that I talk to, the most common thing they say is, I don't feel like myself. I haven't felt like myself for the last couple of years. I don't know what's going on. I don't know where to go from here. That kind of creates a little bit of a tough situation on our end, because we have to come in and say, you haven't heard this from anybody else, but we understand what you're going through. We see this often. We know how to treat this. And, coming in from what is likely an OBGYN that either is going to prescribe a hormonal birth control or a pre-dose patch or recommends pellets, there's not going to be any sort of, oversight on the care. It's just, this is what's wrong with you. This is how we fix it. We'll see in a year and a half. If this doesn't fix your problems, then you're probably just SOL. And it makes for a really unfortunate situation on that side of things. I think that now that we're seeing the trend towards more women being open about what they're using, what it has done for them, the lifestyle changes that they have made, we should see this start to bleed into more of the care that is provided by general practitioners and OBGYNs. But unfortunately, we're just not there yet. So that's kind of my 2 cents on that. It's a pretty unfortunate situation, but it does seem to be improving. I mean, we have probably more women reaching out to us than men than we do at this point in time.
Mm-hmm.
Our patient base is not 50-50, but it's getting pretty close to that. So we're hearing a lot of positive things from women, but the distrust that exists in the space is completely valid and understandable. And we're hoping that it improves here in the next couple of years.
Yeah. And so I've been doing hormone replacement therapy for a year now. My personal regimen does include progesterone and then small doses of testosterone. And I think a lot of women also feel like they can't take testosterone. And I think there's still like a lot of misconceptions around what testosterone means for a woman. And I think a lot of women still think if I take testosterone, it's going to turn me into like this very masculine, deep voiced, like over muscled person. And so I would make the argument that does not happen. Having been someone who's been taking testosterone now for a year, and I'm exactly the same. And to be honest, like even taking testosterone, it's not going to change your body composition a whole lot if the nutrition, the training, just like for a male, isn't there. So walk us through like some of the stigmas or like the rumors that you hear, and let's like start dispelling those.
Yeah. So rumors here. The most common one we hear from patients is that HRT causes cancer.
Mm-hmm.
In some form, that is true. When they're talking about that, those studies were done on synthetic forms of HRT. So the most common one that people are going to know of is going to be the birth control pill that gets prescribed to, way too many teenagers out there. And that does pose some serious issues from a long-term standpoint. Providing those synthetic hormones is going to cover up symptoms of, deeper issues. PCOS is going to be a common one. Those symptoms aren't going to show through when you're taking, but that will keep progressing. So by the time you come off, you have a rebound of these symptoms. It's just expected at this point that, you're going to have some serious pain. You're going to have very heavy cycles, and the big issue there is going to be fertility. I personally know a handful of people that were on the synthetic pill for a long time and came off and had pretty severe PCOS that was masked by that, by being on the pill. It's pretty dangerous. When we're talking about HRT on our side of things, we're talking about bioidentical hormones. So those are going to be chemically identical to the hormones that your body is producing itself. So when we're supplementing those, because that's really what it is we're hoping to achieve what your levels were at when you were at, your prime, for lack of a better term, when your body was functioning as optimally as it ever has. We want those hormone levels to be there. So that's going to be the most common one on the women's side. We do also have the testosterone is going to turn you into a man type of things. That's also a very common one. The key distinction there is that the doses that we are looking at on the female side are probably about a tenth of what we're using on the male side of things.
Mm-hmm.
And to put this in perspective, this same exact argument exists on the male side of things as well, where we get a lot of patients coming in from other clinics and they say, well, I was with this clinic, my estradiol went up to 60. That, to us, that's not concerning at all.
Mm-hmm.
Both guys and girls need all of the hormones. They interplay more than we probably understand at this point in time. So one of the most common things is we see guys that say that they absolutely need to be on an aromatase inhibitor. So for patients that might not be or people listening that might not be as well versed, an aromatase inhibitor stops the conversion of testosterone into estradiol. The issue there is that estradiol is very neuroprotective. It's very cardioprotective. It helps with bone mass. It actually regulates libido, which is the opposite of what people oftentimes think it does. So if you're crushing those levels into the ground, you can develop joint issues. You're going to have brain fog. Your libido is going to be in the tank. We see this whole slew of things that come from trying to suppress this female hormone inside of the male body. The same thing exists on the women's side. If a woman is not producing enough testosterone, we're going to expect brain fog. We're going to expect inability to influence or control body composition. Strength is going to go down. Energy levels are going to go down. And, primarily the biggest thing that most women are going to report feeling from testosterone is that testosterone makes effort feel good. So when motivation is in the tank, it stops feeling good to check things off a task list. That is probably a testosterone deficiency. So it's, you're not going to get traps up to your earlobes. We're not going to start growing facial hair, but you are going to, once that's optimized, you're going to feel a lot better. It shouldn't be looked at as a male and female hormone. It's just a hormone. It's a signaling molecule, and women do require it. Although much, much lower concentrations than men do.
Yeah. And for me specifically, I think the biggest thing that I noticed over once I started my hormone therapy was also just like I was having a lot of negative thoughts. And
Mm-hmm.
like I've dealt with like moods and some mild depressive symptoms for most of my life. And I noticed during those couple of years where my hormone levels had really changed. And again, this is just my personal experience. It's not going to be, across the board. But I did notice during that time as I was kind of transitioning into perimenopause that like sometimes those negative thoughts, that anxiety, and even like those depressive symptoms were amplified to like a degree that I had never really experienced in my life. And when I started my hormone therapy, a lot of that went away,
Yeah.
just on its own. And initially, I had started progesterone before I even started testosterone. And from like a quality of life standpoint, sleep specifically, and also my sex life at home improved dramatically, just as far as like an enjoyment level. The insomnia had kind of resolved for the most part. I didn't feel like uh, I wasn't taking hours to fall asleep anymore, and I wasn't waking up as frequently as I had been before I started the progesterone. And then
Sure.
also just from like like enjoying sex again with my spouse, like that all happened within a very short time period after starting progesterone. And then
Hmm.
quality of life has just continued to improve as I started testosterone.
Yeah.
And I would also just like to point out that, like, as a female, I think sometimes we also carry like a higher mental load sometimes. And
Hmm.
so, in conjunction with hormone therapy, I also do just therapy with a counselor as well. And so if you're like if you're somebody who tends to be like, because we talk about males in the tactical space being high performers and kind of like burning it down all the time, females on the other side can also be, find themselves in that situation where they're kind of burning things down a little bit. But
Absolutely.
I would argue, like, our thought process, it like, I feel like we don't compartmentalize as well as men do, right? Just in that regard.
Hmm.
And so doing therapy and counseling in conjunction with hormone therapy, as well as continuing a healthy lifestyle, um, like, I think it's important to point that out, just like we do for men. But
Absolutely.
yeah.
I couldn't agree more. My wife is actually a therapist, and so prior to meeting her, I don't think that I understood the importance of it, and it was something
Yeah.
that I felt was there was a stigma for it, but I don't think that's the case at all. And I'm thankfully I think that's starting to go away, especially in communities of high performers, to where this is not something that we should sit back and neglect. It's something that should be front of mind. And I think you're absolutely right on the women carry a much higher cognitive load than men.
Mhm.
In my experience, I can work with about one thought in my head at a given time, and my wife carries 20, 30, 40 at any moment.
Yeah.
And it's just not something that I'm capable of. But like you said about progesterone, that is a huge one as well. That's probably the most common women's hormone that we prescribe. We see it a lot for patients that are dealing with sleep issues. It's referred to within the space as the happy hormone. It does
Hmm.
regulate mood. It's been huge for patients, especially those that have, pretty severe symptoms leading up to the cycle of mood changes. They're not feeling like themselves. They feel like they're in a cloud. That's one that we oftentimes, even if a patient is not on long-term HRT, but something that we can supplement on an as-needed basis going into those times to get those levels back into a range that's needed to, function as yourself, um, for lack of a better term.
Yeah, and I think kind of one of my last follow up questions to that would be with females. Is there a point where hormone therapy would stop? So with males, typically once we start
Mhm.
hormone therapy, there's going to be some long term, like, we need to continue that hormone therapy. Is it the same with females?
Yes, it's going to be the same with females. Unfortunately, where we're at with these things, there's not a way to help the body to long-term re-regulate hormone levels to where they need to be. Um, we have seen this a little bit in the last few years with a lot of companies marketing enclomiphene or Clomid as a testosterone replacement for men. Um, Unfortunately, that drug is not meant for use in long term. It's originally designed was a female fertility drug. There are some issues with using it long term, vision issues being the most common. On the women's side, we don't have anything like that yet. It is probably a lifetime commitment. That said, if it's not working for you and you want to get off, there is no downside in getting off. Just understand that you can't retain the benefits that you had of the optimal hormone levels once you're off, because now you're relying on your body's natural production rather than supplementing to reach those optimal levels. And while we're on that topic, we do get this question a lot from the guy's side too, as to whether or not TRT is a lifetime commitment. Yes and no. It's a little bit of a complicated answer. While you're taking testosterone, it does suppress your body's natural production. That is, well documented. We understand this well. You can get off of TRT, and really the impact on your testosterone levels after probably 16 weeks is going to be fairly minimal, depending on the amount of time that you were taking testosterone.
Mhm.
So that kind of takes us back to the misconception thing that we talked about earlier. But I figured I should follow up on that while I had it in mind.
Yeah, and I've definitely seen that too, where if somebody's not necessarily suffering, or the reason that they start HRT isn't because of some type of primary hypogonadism,
Hmm.
it's common to see people who have used testosterone for a long time as an anabolic, like coming from the bodybuilding community, or,
Yep.
they used it when they were younger as a performance enhancement. I have definitely seen, and it takes years, where people have
Hmm.
kind of moved away from using it as like an anabolic uh, enhancer to they want to just like live healthfully. And
Right.
so there is a process there where you um, can do that and live healthfully on much more healthier, more natural physiological doses, uh,
Absolutely.
for sure. And I think this is another reason why it's so important that you actually need to work with a provider and not necessarily be fully reliant on gray market or even black market,
Hmm.
therapeutics, right? One, because you don't really know for sure what you're getting. And so there's always a certain level of risk there. Versus if it's being
Yes.
prescribed to me, then there's licensing, like we know what pharmacy it's coming from, right? So there's
Hmm.
there's a lot of safety metrics in place for that. And if we get to a situation where we can uh, change dosages, or we maybe our provider when we meet with them says that, hey, this is maybe a good time for you to consider coming off therapy, or we need to
Hmm.
increase dosages, right? Like you have someone there who you can rely on to manage that therapy for you. And so for me, I think having that safety net and that level of um, provider who can guide my hormone therapy is really important for setting kind of all my anxieties around hormone replacement therapy,
Right.
helping me manage those, right? Manage
Yep.
expectations, manage sort of that anxiety around using.
Yeah. And I think you made a good point. There's a big key distinction in between patients that are using TRT as a therapy rather than as an anabolic. Um,
Hmm.
so we do get quite a few patients that come in that say, I've run my own cycles for the last 10 years. I'm starting to run into issues. I can't regulate these things in the same way that I could when I was 25. It's a fairly common thing. It's no judgment from our end, but those do create issues over the long term. The main distinction there is that, for TRT, throwing a big blanket statement, generally we're looking at doses between about 100 milligrams and maybe 250 milligrams on the higher end per week. Whereas, you see a lot of people using it anabolics. They're taking, some of these guys are taking upwards of a gram a week, so over 1,000 milligrams. There's, a lot of talk in between side effects of TRT where it gets blended in with side effects of taking these anabolics. So the same people that are maybe on 3, 4, 5 different anabolic compounds are lumped in with the same type of people that are using TRT at therapeutic doses as a lifestyle management rather than, somebody that is, trying to get as jacked as possible. So that is a big distinction to make, and it's something that we hear quite a bit at the clinic. And unfortunately, that has contributed to that stigma on the women's side as well of taking testosterone is going to make you, you know, jacked and grow facial hair when it just doesn't really happen.
Yeah, it for sure. And I can testimony to that as well. But quality of life, fantastic. Um, so let's kind of talk about like getting started. How can I get started? So I'm going to provide my personal referral links to you guys in the show notes. So if somebody clicks on that link, they input their information. Like, what can they expect next?
Yeah, so once your information is in there, you're going to hear from us about blood work. We're going to send an order to a Quest Diagnostics for you. You'll have that drawn. Once we get the results back, we'll reach out to you to get you scheduled with one of our providers. Um, if you do have some, needs that you feel are not being met by a current provider, you can go to our website. We have a tab under About Us called Our Team, and that'll give you a bio on the providers that we have on staff with us. and select one that works best for you, or that feels, meets the qualifications or has the background experience that you feel is relevant to your situation. Once that happens, that'll be typically about a 45 to an hour long meeting to discuss that blood work, go over your symptoms, go over what you feel is necessary for care, and move from there. Once that's done, we'll schedule blood work for about 8 weeks out, follow up, make adjustments that need made, and we'll continue that cycle until everything is dialed in to where it needs to be. But that's probably, I should mention here that we did roll out a military, law enforcement, first responder discount last week that also goes treatment plans and peptides, which is something that we had not had in the past. So we're really excited to be able to offer that now.
Yeah, awesome. My personal experience, one of the things that I love is that there's like I guess you would call it like a customer care person who
Mhm.
texts me on a regular basis. And so they let me know, hey, like your lab work is ready, or hey, it's time to go get your labs done. And they'll check in with me periodically. Hey, are you ready to reorder? How are things going? How are you feeling? Is there anything that you need? And so like again, like I have a lot of stuff always like on my calendar and juggling around in my mind. So the thing that I've really loved is having that customer care representative just like check in with me and be like, hey, it's time to do this, or how are things going? So I love that.
Awesome. Yeah, I'm glad you've noticed that. We try to make everything as easy as possible. Everybody's got super complex lives, and this shouldn't be something you're thinking about on a daily basis outside of taking your meds. So we've got a really solid team. They do a great job with helping patients stay on top of everything and helping them along where their needs help.
Yeah, absolutely. So thank you so much for chatting with me today, Elliot. I really feel like this is going to help a lot of my athletes really kind of be more informed about what they're going to do with their treatment plans. So thank you for that.
Awesome. Yeah, thanks for having me. It's been good.